a lot of information that's coming in about this Omicron variant of concern that was classified by WHO last Friday. We're learning every day a little bit more about this variant, but it will take some time for us to have the complete picture about what this variant means in terms of the way it will behave as it transmits and spreads. We have reports of Omicron in 38 countries in all 6 WHO regions, and we do see increasing trends in Omicron in South Africa. So there is a suggestion that there is increased transmissibility. What we need to understand is if it's more or less transmissible compared to Delta. The Delta variant is still dominant worldwide. That's important to keep in mind. So we need to see how Omicron compares with Delta when they're both circulating in the population at the same time. So it'll take a few more days, for us to get that information, and we're grateful for that research that's ongoing. With regards to severity, we have reports of people who are infected with Omicron that range in disease severity, from mild disease all the way to severe disease. Initial reports of Omicron came from a cluster of university students. And these tend to be younger individuals, and those individuals tend to present with more mild infection. So there was initial reports that it tended to be more mild, but it's really too soon. Because first of all, everybody who is infected with SARS-CoV-2, regardless of what variant, will always start out with a mild disease. And so maybe it will stop there with mild. Some people are asymptomatic, of course, but it may stop with mild disease, or it may take some time to develop severe disease. So it's too early for us to really understand severity for Omicron. We do also note that South Africa has reported increasing hospitalization rates, but that could be for the fact that we have more cases. If you have more cases, you will have more hospitalizations. If you have more hospitalizations, you'll have more deaths. So we need to determine, is it the factors associated with just any virus that's circulating in the population? Because if people are mixing, you don't have public health and social measures in place, and you add another variant, you will have more cases. Or is it actually the variant itself that is causing more severe disease? So that also will take some time. What we know right now, we consider several factors. One, we look at transmissibility. Is it more transmissible or less compared to the other variants of concern that are circulating around the world? We look at severity and disease presentation. Is there a change in disease severity, either more or less? And we look at impact on countermeasures. The use of public health and social measures, do they still work? Diagnostics, therapeutics, vaccines, do they still work? So there's a lot of research that's underway. In terms of transmission, there's data that is coming from South Africa and from some modeling groups that are looking at the transmission. We do see an increasing growth rate. We see increasing numbers of Omicron being detected.